Hi everyone, it's Kelly from the Hub. It's good to see you. I am here with Stacy. She is in the strokes department at the hospital, and she knows all the things that I have no idea about stroke. So, how are you, Stacy? It's good to see you.
Well, thanks for having me. I appreciate this opportunity to talk and educate the community.
Absolutely. So, um, I'm not sure what we're talking about today, but I know you are. So, what do you want to chat about?
I want to talk about hemorrhagic stroke, which there's two different kinds of stroke, and most of the time we talk about the first kind, which is ischemic stroke. And
Okay,
we
what's the
talk,
difference?
the difference is that an ischemic stroke is a clot in the brain made of either blood or plaque, fat and trash. Okay, and a hemorrhage is caused by a bleed in the brain.
Is one more dangerous than the other?
Yes,
Okay.
a hemorrhage is much more dangerous than an ischemic stroke.
Because the blood's just going, you're just bleeding.
You're bleeding, and if it's unchecked, and you have, depending on where you have it in the brain, you can literally just die from it. The other issue is that ischemic stroke, there's a lot more treatment for than there is hemorrhages. And a little bit of blood in the brain, your brain doesn't like blood, and a little bit of blood is more dangerous actually than a whole bunch of clot in the brain.
Thank you. That's a wonderful way to understand that. Good. That's very helpful. Okay, so we're going to talk about hemorrhagic strokes or bleeding on the brain. And so tell us some stuff.
So there's a lot of different causes for ischemic stroke. There's whether you have a heart arrhythmia, or you have high cholesterol, or you've been using drugs or drinking too much. Drinking is actually an ischemic stroke risk factor, or you have a clotting disorder or something. But there's really only one risk factor for having a hemorrhage. There's several different kinds of hemorrhages. There's I fell down and hit my head kind of hemorrhage. That's not a stroke. That's trauma.
Okay.
So some people will hear the term subdural hematoma.
We've heard that on all the TV shows.
Right, and that's not a stroke. That is a trauma. Then there's an aneurysm, which we all know about and have heard about, maybe for a TV movie or a soap opera or something like that, or we know somebody who's had an aneurysm, and that's actually a stroke.
Oh,
So yeah, so that's
okay.
actually a stroke. It's caused by the same reasons that other hemorrhages are.
Okay.
Then there's a hemorrhage that you bleed in either into the ventricles of the brain or into the brain tissue itself, and you kind of like either bleed freely or kind of ooze. And the bottom line is they're all caused by unchecked high blood pressure.
High blood pressure makes all of those things happen in your brain?
Yes.
Oh, for heaven's sakes. Okay, and what's the percentage of Americans that have high blood pressure? Isn't it like
It's a
all?
lot. And
Yeah,
it depends on
it's a
where
big.
you live.
Okay.
So, or if what race you are even. There are some races that have more problems with high blood pressure than other. This area, this part of Lancaster is largely Caucasian, but we're also very Pennsylvania Dutch, and that includes myself. So there is not just the usual Pennsylvania Dutch risk factors of weight or anything else. There's actually a genetic component with us of having high blood pressure. Now, I am certainly, my biggest risk factor is the fact that I have the Pennsylvania Dutch fluffy figure. But I also have been hypertensive since I was 30, which I was, was thin at the time. And my father was hypertensive since he was 30, and my grandmother was hypertensive since she was 30.
So
So
that
there's a
runs in your family.
correct. And
Yep.
this is not all Pennsylvania Dutch families, but there's a larger percentage than there is in others.
Okay.
So 85 to 90%, depending on which study you're reading, of strokes are ischemic strokes, but 15 to 10% are hemorrhagic. And those that are much more dangerous. They're much sadder. They have a little bit different symptoms. And sometimes they don't have any symptoms at all. The person just basically dies in front of your eyes. So I want to tell a little story. I have, and this fits into it, I have a family member who's not Pennsylvania Dutch, from my mother's side of the family, and who lives in Alabama. And we got sad news that he died, my first cousin, he died on Sunday night, and he died from a hemorrhagic stroke. And this is what happened, and this is what we see, and what I see a lot in the hospital is he had regular high blood pressure that was under control by the doctor for some time, and he had been taking his medicine and doing okay. And then he started having headaches, and he went to the physician, and they found that his blood pressure was higher than it had been before. That his meds weren't taking care of that blood pressure that he was having. And that happens. I mean, you don't just get high blood pressure once, and that's how your blood pressure is going to stay for forever. It changes. So it was high enough, and usually it was high enough that they recommended that he be a direct admission to the hospital.
From the doctor's office.
Yes. So usually they only do that when your blood pressure is well above 200.
Yep.
So my cousin did not want to go to the hospital, whether he was afraid of hospitals, didn't want to be bothered with a hospital, or even afraid to come to the hospital because of the pandemic. There had been quite a bit of fear of that some time ago, for a long time. He chose not to do this. So that resulted in his blood pressure not being adequately controlled. And on Monday morning, in the middle of the night, basically, my other cousin found him in bed, and he had passed away in his sleep from a brain bleed. So please control your blood pressure. There in our area, you can go to your general practitioner, but there are actually blood pressure specialists in our area, which is unusual. I worked in the city of Philadelphia for a long time, and I didn't know any people that's all they did was take care of blood pressure. And these guys actually are nephrologists, but they really specialize in high blood pressure. So they do that. Cardiologists can take care of your blood pressure, but if you have high blood pressure, you're never not going to have it. You're never going to be able to stop taking your medication. It doesn't mean that you're cured. And most likely, at some point in your life, your blood pressure is going to get higher as you get older, and you're going to have to take more medicine or switch your medicines around.
I know that you shared that story with us so that as a cautionary tale to make sure that people are being thoughtful and to know that this is one of those things that you can't wish it away, you can't hope it away, you can't do anything. You got to go to the doctor and manage it, and do what you need to do so that you can manage it.
Right.
So how would I know if I had high blood pressure?
Well,
Could I feel it?
No, most people don't. Some people do get headaches from it, or they get dizzy, but that's only if it's really high. One of the best ways that I really like as a stroke coordinator, first of all, if you're past a certain age, certainly which I am, you need to go to the doctor twice a year, at least.
You just got to bite the bullet and do it. It doesn't matter
if you
want
do
to.
it.
Right. Just do it. Yeah.
Nobody likes to go to the doctor. I don't like to go to the doctor. You have to sit and wait to see the doctor. You got to pay the doctor. The doctor's going to tell you to do something you don't want to do. But this is the way it is, and we got to do it.
Right.
I mean, this was a totally sad, unnecessary death that could have been prevented.
Yeah.
I just, it's just really hard. The other thing about that, the other way that you could check to see if you have high blood pressure is every grocery store now that has a pharmacy, and even some that don't have those blood pressure, the CVS does, Walgreens does, pharmacies, grocery stores, take your blood pressure there. Now, if you have one bad blood pressure, don't get excited. But if you do, that means that you need to take your blood pressure again somewhere else. If you have two, pick up the phone and call the doctor.
And there are lots of kinds of medicines out there that can help you and that your doctor knows about that.
Right.
And it's also one of those things, there are so many pharmaceuticals that are advertised on TV that people walk into the doctor's office and say, I want fill in the blank. Well, here's the thing. Only the people who have the degree, who've studied that stuff, should be telling you what to take, not you telling them what to take.
Right. And doctors do see this. I know that, in fact, a funny story is my doctor told me one time that she had a patient who came in for high blood pressure, and they saw one of the new diabetes medications advertised on television. And the patient demanded to be put on that for their high blood pressure. And obviously, a medication for diabetes is not going to help your blood pressure. It's just not.
Right, right. And I understand. I mean, we don't have to go further into that conversation, but that's one of those things. Let the doctor do what that person has been trained to do so that you can get better and feel better.
Right. So the other thing is that your doctor is most likely going to put you on a medication. There are so many medications and so many different kinds of medications for blood pressure. And your physician is probably going to write you for one that you can afford. Thankfully, that's one of the medications we've had out the longest. And there's a lot of very good blood pressure medication that's very reasonable. One of the blood pressure medications that I'm on, even without insurance, a full 30 days of it costs $10. So it's very reasonable. And for those of you that are having problems paying for medication or whatever, there is a Walmart I know in the area. And Walmart has a $4 medicine list. So there are certain medications that Walmart will provide to people that are considered very, very essential medications. And blood pressure medicine definitely is on that list. And you can get your medication for $4. You can also come here, and if you really are having a problem paying for your medication, we can help you out. Don't get me wrong, it'll be, it's a bureaucratic process because that's the real world. But we'll help you to manage and give you counseling and maybe even give you the first 30 days of your medication free. So there's ways to help it. The other thing is that a lot of times people stop taking, and I see this with everything. I see people stop taking medication because they're having side effects. Well, everybody's different. So one drug that would cause a side effect for me might not cause a side effect for you, and vice versa. But there's so many different medications out there that if you pick up the phone and call your doctor and tell your doctor what side effect you're having, your doctor is easily able to write a new medication that might not give you any side effects, or probably won't.
That's perfect advice to know. This is
Yeah.
good. Every time we chat, I learn something else, and I think everybody else does too. So, Grace, as always, it's wonderful to chat with you. And I will see you again next week, and we will talk about something else in the universe of strokes, huh?
We will.
That sounds great. Can't wait. See you,
All right.
everybody.
Thank you. Bye-bye.